So this is gonna be a brief coverage of what Medicare is, just to touch base on it so you feel a little bit more comfortable about it. Like I said, with all this Medicare education, we want you to feel comfortable with your level of knowledge. We don't want to put you in a setting where you're giving people advice that you're not necessarily comfortable with the content, you don't know very much about it. We want you to stay away from that. So a lot of this is just knowing those boundaries, not getting into educating people on things you don't know very much about or on the wrong thing. We want to make sure that's not happening. We want to keep our reputation as a good quality program. So that all starts with us knowing a lot about Medicare, and even just a lot of what we might not know so much about Medicare too, so it's kind of complicated in that way. But Shine, and this is a presentation we give out in the public too, so it's not necessarily from a volunteer eye, but what Shine does, and I'm sure you have a good grasp on it already, but we educate Medicare beneficiaries on their benefits and ways to lower costs. We help Medicare beneficiaries prevent, detect, and report healthcare fraud. We help preserve the integrity of the Medicare program, and we rely on our volunteers to help Medicare beneficiaries across South Dakota. We make sure to tell individuals that we help that we're not affiliated with any company that sells insurance or distributes a product or service. We're unbiased, and we're very happy to say that, because there's a lot of very biased advice. Usually people go to their insurance agent and they'll recommend the product that they sell, which is okay if you have a good insurance agent, but a lot of, it's nice to have a program like this where they know we're not talking or not giving them advice that it's objective advice. We also we want to make sure that we are giving out the impression that we are free service. We're not collecting any cash or cookies or anything for our services. And we keep our information confidential. We're not telling our friend or our spouse all their problems, because they're giving you health information, they're giving their medicine list, they're giving you their social security number, the birthday. That's all kept confidential. And then once again, that is unbiased. We're not affiliated with any other service or insurance company. We already went over the mission statement and talked about our regions. How we help people is through those regional contacts that helps us spread ourselves and manage the program throughout the state. Medicare, we're going to touch on the basics of it. Medicare was initiated in 1965, passed into law as our nation's health insurance for individuals age 65 and older. It started out with just the hospitalization, Part A, that insurance, and it has expanded over time. But as you may know, anyone over 65 is eligible to receive Medicare benefits, and some individuals under age 65 can receive Medicare as well, but they have to qualify in a way or two. One of the ways to qualify for Medicare under age 65 is if you have received Social Security disability benefits for 24 months or more. So on your 25th month of receiving Social Security disability, you would be eligible to begin Medicare. The reason for that is that it needs to be proven to be a long-term disability. It's not just for somebody who is on Medicare disability for 10 months or so. I don't even know if you can apply for it in the 10-month time frame. It takes a long time to get on it too. It's pretty complicated itself. But so after 24 months, you can start Medicare. And there's certain diagnoses that you could actually be on it earlier than those 24 months, and that would be end-stage renal disease or permanent kidney failure. Otherwise, ALS, or also called Lou Gehrig's disease. And Medicare is not designed to be free health care. It is not free, and those that think it quickly learn it has a cost to it. And it's not designed to pay for all of Medicare medical bills. It does have deductibles, co-insurances, and some parts of Medicare have premiums. And it covers over 52 million people in our nation. So that's quite a large insurance company, the federal government. As far as when somebody were to receive all the information they need and actually be enrolled in Medicare, once they enroll on their own, they receive that Medicare number and a Medicare card. If right now Medicare numbers, the Medicare cards contain a Social Security number, and that will be changing. I think they plan on starting the rollout in 2019, but there's already a lot of talk at the federal level that it's a very complicated rollout, and it may be longer than that. But it's a big change. What they're trying to take on, but it's a very important change to get those Social Security numbers off of these cards. To apply for Medicare, you need to apply about 3 months before you want to begin your benefits, which could be when you turn age 65, so 3 months before your birthday, or 3 months before any current coverage that you have. Let's say you work and you have employer coverage, it'd be 3 months before you plan that coverage ending. So if you work till age 70, you wouldn't have to start Medicare earlier than that if you didn't want to. Same thing if your spouse has employer coverage, and you're on that plan. You may find that's cheaper than Medicare and you want to stick with that. So you'd want to apply 3 months before that ends. Otherwise, if you're already receiving Social Security benefits, let's say you already are enrolled or drawing those benefits and working part-time, you would actually be automatically enrolled into Medicare. You'd get your packet about 3 months before your birthday, and so they would take care of that, enrolling in Part A and Part B for you. Some people will decline Part B. They will say, you know what, my husband's still working, I just don't need this Part B right now, I don't need to pay that $121.80 a month right now, so I'm going to cancel that. So you mail, it gives you instructions, you mail the card back, and then they send you a new card that does not have an effective date for Part B. So there's instructions on how to do that. We talked a little bit when we talked about enrolling in Medicare, original Medicare, that's Parts A and B. I'm just gonna do a quick overview here. Part A is what Medicare initially started out being as a hospital insurance. That would cover inpatient hospital stays, and it's pretty much limited to that. A skilled nursing facility, we're gonna get into all the details of it. Medicare Part B, that is medical insurance. So if you go to a clinic, have outpatient care, whether maybe you're in observation status at the hospital, it also covers preventive services, things of that sort. Like I said, we're going to go into all of these. Part B would take care of that portion of it. That one does have a premium of $121.80 this year for new beneficiaries. Then there's Medicare supplement insurance or Medigap insurance that would help cover the additional costs of Parts A and B. So some people pick up a medical supplement or supplemental insurance, a Medigap policy, to help with the costs. And then for prescription drug coverage, there's Medicare Part D. And if an individual would like to go with a Medicare Advantage plan rather than original Medicare, there are standalone plans sold by private insurance companies that would group all of these things. They don't have to include the prescription drug coverage, but they can, and those really vary in coverage and cost, but that's an alternative to original Medicare that an individual could choose. So that's an overview, and we're gonna dig into each one. So hospital insurance covers inpatient hospital care, like I already said, inpatient skilled nursing facility care. That's maybe you're doing some rehab. There are certain criteria to qualify to be able to use the skilled nursing facility care under Part A, and that would be a 3 overnight or 2 midnight stay in a hospital as an inpatient. So you have to meet that requirement, and then the rehab care at a skilled nursing facility would have to be relative to the hospital stay. And so that's one part of Medicare Part A. There's also home health care and hospice care that are covered under Part A. Medicare Part A is typically premium free. Most people have 40 quarters of service with Social Security where they qualify for a $0 premium with Medicare Part A, or maybe their spouse has that working history with Social Security and qualifies for premium free Part A. The reason for that is you pay in through the FICA taxes with your payroll check, and that helps you. That's how Medicare Part A is funded, is through that payroll taxes. You can draw under another person's record, and you can still get Medicare Part A. Let's say you don't have that 10 years or the 40 quarters of service with Social Security. You can have Part A, but you would have to pay a premium. I think if you didn't have any service, it'd be $411 this year, I think is the premium it would be. So it's a very valuable benefit if the premium is $411 for those that have to pay it out of pocket. Social Security administers Medicare Part A. So for information on who's entitled to Medicare, who would be able to draw Medicare Part A benefits, you talk to, we would direct them to the Social Security Administration. They handle that enrollment and the entitlement of that. Part B covers doctor services, durable medical equipment, wheelchairs, walkers, oxygen, also called DME, home health care, x-rays and lab services, outpatient hospital services, like I said, observation statuses, mental health services, and most preventive care services are covered by Medicare Part B. Medicare Part B does have a premium. Like I said, this year it's $121.80 for those going into Medicare. This is a tricky year because they did need to issue an increase for premiums for Part B. However, Social Security benefits did not receive an increase. And because most people draw Social Security benefits that are on Medicare and have the premium deducted from that Social Security benefit, because Social Security recipients did not receive a cost of living increase, they could not take out more money, do an automatic withdrawal of anything more. So those that were already receiving were already having Medicare Part B taken out of their Social Security check did not see an increase from the prior year. So they are only paying $104.90. And there was a lot of compromising, a lot of political negotiations going on with this. So what's going to happen is slowly as they're going to get cost of living increases for Social Security, hopefully the economy does well enough for us to do that, or for Social Security to do that, then we'll see those premiums go up, and that'll include a larger pool of those receiving Medicare Part B. If you don't have it automatically deducted from your Social Security check, you can pay in a quarterly payment to Social Security. They have an easy pay system. So if you enroll in Medicare Part B after you turn 65, if you don't have other credible insurance coverage, then you would be assessed a penalty. So if you have current credible coverage, your employer coverage, maybe for Medicare Part B, let's think of another credible coverage. You have TRICARE benefits, you're a retired military person, they have credible coverage with TRICARE benefits, then you would not have that penalty. And also if you'd have a special enrollment period up to 8 months after that coverage, that credible coverage terminates. So you'd have some time. there. So, if you don't enroll right away, not only would you probably be assessed a penalty if you don't have credible coverage, but you also need to wait for what's called the general enrollment period. That happens each year from January 1st to March 31st. You can enroll in Medicare. Otherwise, you have to wait, and then when you do that, you would have to wait for July 1st before Medicare actually kicks in and is effective. And then also, in addition to that, that penalty. Common misconceptions of what Medicare covers. Medicare does not cover long-term care, so it does not cover long-term nursing home stays. It does not cover dental care, routine dental care, does not cover vision care, cosmetic surgery, acupuncture, hearing aids or exams for fitting hearing aids. There's certain, like vision, macular degeneration, it'll cover a few things with that, but not a lot. It's not extensive coverage. It's not the vision insurance you may have working with an employer or dental insurance. There's not that available for Medicare beneficiaries. They'd have to find a private insurance to pick up for those things. So we talked a little bit about Medicare Parts A and B and all what they cover, but along with that, there's a lot of, there are deductibles and co-payments, so there's a lot of expense that could take place, especially if you're utilizing your health insurance. If you're ill or need surgery or have cancer, something like that, you would be required to pay a lot out of your own pocket. So they have allowed Medigap plans, which are a supplement to Medicare. They're sold by private health insurance companies that need to be licensed in the state of South Dakota. A Medigap policy may help lower your out-of-pocket costs, because what you would do then is you'd pick up a premium, you'd pay this private insurance company, let's say $100 a month, to take care of, if you do get ill, all those variable expenses that could take place once you start receiving bills after your Medicare pays. And it does a lot of times give you, and it expands your coverage, insurance coverage, to help pay for more items. So there can be, in addition to just covering those gaps, it could give you a little bit more health insurance coverage. But there's a lot to consider before picking up a Medicare supplement plan, weighing that cost. And not oftentimes is it, sometimes you're weighing it based on your current health need, but you also got to consider your future health needs. Maybe you'll have, as you age, typically your healthcare expenditures do go up, so it's a little bit of risk. You got to make a lot of risk decisions there. In our Shine, we have a supplement guide to help people make decisions, because I'll read through this list first, and then I'll talk through how we help explain this to people. With a Medigap plan, individual must have Medicare Part A and B, and the plans are standardized. The federal government said, okay, private insurance companies can sell it, but this can be very confusing on the quality and scope of coverage that these plans are offering. So they made up a standardized plan, and you can get one of these in the back, but they standardize them by letter. So there's A, B, C, D, F, and they skip a few because some of them get phased out over time. But I believe there are 9 different plans that are available. So you can shop by coverage, and once you know, let's say I want a plan F, I like all that it covers. When you shop from that point on, you're just shopping based on price, not on the quality of the coverage. So it simplifies that for the consumer, so they don't have to worry about, is my Part B deductible covered or not. They know if they're shopping for a plan F, yes, my Part B deductible would be covered. And I think that this year is $147. You pay the first $147, and then Medicare would pay what they say they'll pay after that. The plans have premiums, and that's based on what plan it is, also based on your age. There are a few other variables to the cost of the plan. Oftentimes women are a little cheaper, and oftentimes if you are not a smoker, it's a little cheaper. So there are a couple other things that could affect the cost. But the plan cannot cancel your Medigap policy based on your health issues or the claims that are going against that plan, as long as you pay that premium. So once you're in the plan, people oftentimes just stay with that plan. I think the next phase, this talks about buying a Medigap plan. There's an open enrollment, they call it, or a guaranteed issue right. Within your first 6 months of starting Medicare Part B, there's a 6-month window that you can enroll into any Medigap policy without any medical underwriting. So you don't have to worry about your current health conditions. Every plan would just have to accept you into that plan. So anytime after that first 6 months of starting Medicare Part B, they can underwrite you. So if you have current health conditions, they may say, we're not able to provide you coverage. Or they may have a window of time that you'd have to wait before they pay any claims for your specific condition. So that's a reason why many people will delay Part B. Let's say they're still working, they want to pick up Medicare Part A because it's free, and a lot of times their insurance company requires that they pick up Medicare Part A so that Medicare will pay first and then the employer will pay second, or the employer's plan. So a lot of people will delay picking up Part B, first of all because of the cost, because there's a premium associated with it, and second of all because it would also allow this 6-month guaranteed issue right for these supplement plans to happen after, when they're ready to start picking up all of their Medicare insurance. And also there are some open enrollment opportunities or special enrollment opportunities for a Medigap plan if you leave in a Medicare Advantage plan. And then sometimes a company will have their own open enrollment and say, for this time frame, we will allow anybody into our plan and lift those underwriting specifications. So that's really, if a company underwrites after those first 6 months, that's really the company's choice if they want to underwrite or be choosy on who they select into their plan. A Medicare Advantage plan is, like I said, with that first thing, is that darker section when I was explaining how Medicare is all kind of grouped together. It's an alternative to original Medicare. So this is offered only by private insurance companies. And it must provide all of the benefits of Part A and B, but they can add in additional things that they cover. And they can offer dental and vision and maybe silver sneakers and exercise type program. And with all the services, the cost can vary. So even though that they offer, I'm trying to think of, let's say, I'm trying to think of an example. They offered a standard procedure service, they cover it. They could charge more than what Medicare charges. They just have to offer those basic services that Medicare covers, but they can vary their cost. So that makes shopping around for these plans quite difficult. People get a little frustrated and want a lot of guidance. The thing is you can't really help them because there's so many different plans out there. You would spend hours and hours and hours and still not know their health situation quite well enough to give them advice, and we always stray away from advice anyway. But so they really have to do a lot of legwork to decide if a plan like this is proper for them, if it's a good fit for them. There's a lot of risk analysis that they have to do to determine if the cost is worth the quality of the coverage. So shopping around for one is not a standardized plan like this. It can be kind of complicated, and there are tools on Medicare's website to compare these advantage plans And we always suggest that they call the plan and ask a lot of questions. And we have, I'll go back there and talk about it later, but we have a list of questions that would be good for somebody shopping around for an Advantage plan to ask, to make sure that they're asking all the right questions, because these plans can have networks of doctors. So what if their doctor, is my doctor in this network, you know, and making sure that's the case. Making sure that their clinic or hospital is in network. Seeing the cost of maybe some procedures or services that they would receive in the next year or two, getting an idea of what that cost would be as they weigh that choice. And most of these plans do cover prescription drugs as well. So in order to be eligible to purchase a Medicare Advantage plan, you must live in their service area, which you can shop around for these plans on Medicare.gov, so you would know what plans are offered in your service area. You must be entitled to Medicare Part A and enrolled in Medicare Part B, and you must be actively enrolled in Medicare Part B, so you're paying that premium. And most people, like I said, pay it through their Social Security benefit. You can also pay a monthly premium to plan. There is one plan in this area that's a $0 premium, so you don't have a premium for it. But most of them do have a premium, where let's say you pay $150 a month in that. You also pay the Medicare Part B premium, so you pay that still through that Social Security check. And these plans would not cover end-stage renal disease. You would have to be on original Medicare for that. So when you first enroll, if you had end-stage renal disease or permanent kidney failure, you would not be able to enroll in that plan. There are some exceptions. In some states they have special needs plans that are specific for individuals with end-stage renal disease that would cover it properly. So that's the only pretty much exception that I can think of for that end-stage renal disease guideline. Just a little bit more information here on them. You would once again have to use the providers within that plan's network. That's a very important part of choosing a plan. And you would have to pay the Part B premium once again. And the cost can vary from plan to plan. So let's say ambulance ride could be $200 with this plan, $500 with this plan, $100 with this plan. You know, all that can vary based on what plan you have. So that's why it's important to shop around. And like I said, some may offer vision, hearing, dental services. Some offer, and I would say most offer prescription drug coverage. And you still would have the same rights and protections under Medicare if you're in this plan. It's an authorized alternative to Medicare by CMS, or Centers for Medicare and Medicaid Services. And you know, as we're going through this, it's a lot of information. I'm just trying to touch on the basics. Those trainings that you'll do online dig really deep and are really thorough with this information. Medicare Part D, or prescription drug coverage. Once again, obviously it helps with your prescription drug or your pharmaceutical costs. It's also sold by private insurance companies, so you do shop around. It's not offered through the federal government. You'll be shopping around, but through private plans. And the coverage varies immensely from plan to plan. So that's really Medicare Part D, and that open enrollment period is a very important reason why our program exists, because this is so complicated, shopping around for a prescription drug plan. Because not only can their prescriptions be covered or not covered based on what all the plans out there, but also their pharmacy they go to could not be in network. And then, you know, you want to make sure you're in the most affordable, considering all things planned for you. And there is a comparison tool on Medicare.gov, and that's actually the tool that we use when we're out there counseling Medicare beneficiaries. It's a great tool, and so what we do is not special to what they can do on their own. We just are helping them through that process. As far as when an individual can enroll in a Medicare Part D plan, there's an initial enrollment time frame, just like there is for Medicare Part A, and it's 7 months. There's 3 months before they turn 65, the month they turn 65, and then 3 months after their 65th birthday that they can enroll into Medicare. And that's when they'll be eligible. So for somebody who's drawing Social Security because of a disability, it's that initial enrollment period would be at the time they're eligible for Medicare. It wouldn't be 65. Then there is an open enrollment period, like we said, so those that don't join during that initial enrollment period, where you can join a plan, drop a plan, change a plan during that time, and that takes place from October 15th through December 7th. But it happens each and every year, and then when somebody chooses a new plan during that open enrollment time frame, they would start, or that new coverage would be effective January 1st, that following year. There are a few special enrollment periods, so opportunities that somebody could enroll in a prescription drug plan outside of that initial, when they first become eligible for Medicare, and outside of that open enrollment period. And they would have to qualify for the special enrollment period to be able to utilize it. One of them, I guess, that I think of first of all is a special enrollment period when you no longer have coverage through an employer. That would get you a special enrollment period to be able to join a Medicare Part D plan at that time. Also, if you qualify for extra help, that's the low income subsidy or the help assist, the financial assistance available for those who are having trouble affording or meet the income and resource criteria. It's a program out there. If they qualify for that, they can change plans at any time. Also, if you're in a nursing home or were in a nursing home within the past 63 days, you could change a prescription drug plan. A lot of times the reason for that one is because your medications can change a lot in a nursing home setting or even afterwards, after that rehabilitation or the rehab. There's an opportunity, and this is quite new after the Affordable Care Act, but they started ranking the plans based on 1 to 5 stars. Quality of service, care, coverage. There's a lot that goes into the 5-star rating. But if a plan is rated at a 5-star rating, that's the best they could get, you would have, as a Medicare beneficiary, you would have an opportunity to enroll anytime during the plan year, just one time, into one of those 5-star plans. So that encourages the plans to have optimal performance and great customer service and be timely in their appeals processes, all the things that they're rated on. We did, for example, last year we had no 5-star plans. So if somebody wasn't happy with their plan mid-year, they would have to wait for open enrollment. They couldn't just change to one. The year prior, if they were unhappy, we did have a 5-star plan, so they could move into that 5-star plan. It was Blue Cross Blue Shield, but they went by another Medicare Blue. Is that what they went by, Karen?
Yeah.
So Medicare Blue, which is a Blue Cross Blue Shield plan, 2 years ago was a 5-star plan, and they had 3 plans that were offered, kind of a basic, medium, and a Cadillac type plan. And so depending on the prescription someone took, would typically be what would qualify, what one would be the best, lowest cost plan for them. So that was nice. We had some options for people. But this last year has been difficult because our hands are tied. If they're not happy or they find out their pharmacy's not in the network, they're just going to have to change pharmacy. Or they're just going to have to find a substitute for that drug or pay full price for it if it's no longer on their formulary. It's tough. Those are tough conversations to have with someone. So, once again, if you don't enroll in time and you don't have that credible coverage in place, you may have to pay a penalty. That's 1% of, it's called the National Base Beneficiary Premium, for the months eligible but not enrolled. So what they would do is take, this National Base Beneficiary Premium, that's actually an average of the Part D plans nationwide, and I think it was like $35 and change last year, and you would pay 1% of that $35, that figure, for every month that you were not enrolled in Medicare, but could have been, for Medicare Part D. So that can add up pretty quickly, and I'll show you an example of that as we go along here in this book, in this resource
The
manual.
lifetime penalty.
Yeah, lifetime penalty, is that, the only way you'd get rid of that penalty is if you qualify for extra help and didn't have to pay the premium anyway, you know, had an option for that. Yep, so, as long as you're enrolled, yep.
This is probably, well, anyway. When you get to be year 65, you get tons of mail. Literally tons of mail, you know, stacks of it and stuff. And
Rent a PO box.
this is real world, guys. People don't pay attention to their mail. They don't read it, they throw it away, or they bring it all into you here and sort it out kind of a thing. It's crazy. But I've run across, 50 people in 3 years of doing this that didn't sign up and that missed the deadlines and stuff and have penalties involved with it. It's crazy. It's like, you feel just gutted. It's like, why didn't you read your mail? Why didn't you open your, you know, blah, 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 blah. Someplace in your training, we need to be educating people, you know. If it comes from the Social Security Administration or from Medicare, you open that stuff regardless. If it comes from Humana or Aetna or somebody else, you can file that away and look at it later or throw it away, one of the two. But the point is, people don't get signed up with this stuff, and then they are subject to penalties. Goodness gracious, one of the gals, I have a part-time job with, anyway, she missed a deadline. I asked her about this. What are you doing about your Medicare? Oh, nothing. You know, it's like, well, yeah, you need to get enrolled. So we got her enrolled in a marketplace plan, and then her Medicare kicked in July. Okay. Then she got diagnosed at the end of July with throat cancer, stage 4. Yeah, she thinks I'm a pretty cool guy that I stepped in and got her going.
Wow.
But I mean, that's real world stuff. If she hadn't done that, I mean, hell, her, you know, fortunes would have been ruined and she'd be dead. That's how important this stuff is, and that's how important these deadlines are. And people miss that stuff, and it's crazy, but it's real world. It really is.
Yeah, that's wonderful. Thank you for that input, and yeah.
I've run into so many people that oh, I didn't know I was supposed to do a Part D plan, you know?
Yeah,
and
all the time.
I didn't know. 10,000 people a day are turning 65 in America right now. 10,000 people a day. And that pipeline is going to be full of us, baby boomers, we baby boomers for, I don't know how long, you know? 10 years, 15 years. Well, we'll be in this business forever if we want to be that way. Believe me. And it doesn't seem to me like people are getting any smarter. You know?
Well, first of all, I don't think they're used to an insurance product being like, here's hospital, here's clinical, here's a prescription, here. It's not typical of what they're used to with employer plans, or maybe they have TRICARE people are taken care of, or retired military, but even Indian Health Services or whatever other people, VA benefits, it's all grouped typically, and then you have this unique makeup of insurance that is very complicated, and I think people tend to either want to read and learn all about it, or just ignore it and kind of wait to see how it happens and assume someone's going to contact them.
One thing that's helped me a lot is when you think about enrollment for folks, I mean, you're guiding them along, you're a tour guide, you can't make recommendations or anything like that. But in generality, you can say to them, you marry your supplement. If you're going to get a supplement, you marry your supplement and you date your drug plan. And that's how the crazy thing works. It's an easy sell, and it's true. And, you know, just little old me in Sioux City, Iowa, doing hardly anything. I saved people over $200,000 by myself. In Iowa last year, I mean, yeah, we saved over $20 million.
Good
down
night.
there. $20 million. Yes, ma'am. With about the same number of volunteers. It's a bigger population state for sure.
For sure.
I mean, you date your drug plan. You marry your supplement, you date your drug plan. You change those things every year. Just as Jamie said, it's crazy, but you go through and you check through the formulary. She'll tell you about that later on and stuff. But it's just astounding. You know, I could save you $1,000. Really? I could save you $5,000. Yeah, those are big numbers.
Potentially.
But that's what you can do with the drug
Potentially,
plan.
yeah.
Anyway, she'll talk about that later. But you marry your supplement, you date drug.
I love that.
I
I'm using
do
that
too,
analogy
yeah.
forever. Like I said, there's that, once you pick up Part B, there's that 6-month window, that guaranteed issue period of that supplement plan that you do not have to be medically underwritten. Anytime after that 6-month time period, it can be very difficult to switch plans.
So now
So you never wanna drop a plan before having a new one fully in place.
So now you're using that term supplement, is that the same as Medigap?
Yes,
Are they
Medigap,
interchangeable?
yep,
Okay.
they are,
they're
they are,
interchangeable.
and that's confusing. There's a lot of things confusing about Medicare. So with Medicare Part D, there are certain standard requirements. They have to cover these 7 basic areas of medications. They have, and I'm not gonna think of hardly one off the top of my head, but they have to cover cardiac medications, they have to cover some cancer medications, at least one of all these 7 categories.
Yeah.
They have to be able to cover that, so at least you have an option. It may not be the prescription your doctor wants you to take, but it's one of the options. It might be the most generic version, the cheapest version. They have to offer these standard benefits. You would typically, and in all cases in our state, pay a premium. I think the lowest one was $15.80 this last year.
18.
Oh,
8, yeah. Walmart, Humana Walmart,
Humana Walmart was the
1840.
cheapest. 1840, thank you,
Yeah.
yes. That was the lowest cost premium for a plan this past year in South Dakota. Some have a deductible, some do not. The maximum, they do set a cap on that deductible, it's $360.
Went up this year.
Yeah, it will be going up yet again this next year too, I had heard a rumor. And then the prescriptions, as you go to the pharmacy counter, there's a co-payment typically. Not all the time, sometimes some companies will provide the lowest cost by having a $0 generic medication if it's a certain tier. They have different tiers to determine the prices. Sometimes they have different deals with their mail order
Oh,
programs.
yeah. Yeah, some are
and-
really good.
The most beautiful part of this, because the cost is so complicated, is actually quite easily navigated by us through this website, which we're gonna go into later, on Medicare.gov. You just enter their basic information, you enter their prescriptions, you enter their pharmacy,
And
and
birthday.
it does the cost comparison for you.
Yeah.
It's very easy, but you help explain that to them and what, oh, this medication's not covered. Are you sure, you know, you could pay a little more and now all your medications are covered. We show you the details to look at. There is still a coverage gap, or what's called the donut hole. Has anybody heard of the donut hole before? Yeah, that's probably the biggest complaint of Part D. They are phasing out the donut hole. It's under the Affordable Care Act. They're giving it till 2020 to slowly phase out this gap in coverage. It started out that individuals with a Part B plan, once they hit a certain dollar amount that the plan and and that beneficiary paid, they would not cover the prescriptions at all. There would be an absolute no help
Yeah.
gap in that plan. And
Unless
then
you
once they-
qualify for extra help, obviously.
Yeah, unless you qualify for the low income subsidy. And then at a certain point, once you hit a certain out-of-pocket limit, you would hit this catastrophic period where then you'd get some help again with your prescription drug costs. during the Affordable Care Act, they first of all, the first year they gave I think a coupon. And then they slowly increased that cost share between the insurance company, the prescription drug companies, and the beneficiary. They're slowly reducing the amount that the beneficiary has to pay during this donut hole. We're in the middle of a phase out here. From 2010 to 2020 is a 10-year phase out of this donut hole. And we're in the middle of it, so it's changing every single year on us. It's not the hardest thing to keep track of, but it's not a detail you talk about every day. So I forget where we are exactly in it. But what you're gonna get to in 2020 is the insurance company and the pharmaceutical companies, they'll be paying 75% of the cost of the medications, and the consumer would pay 25% of the cost. So it goes from no help to now you're paying a quarter of the cost you used to. So it's phasing that out, and that's what that coverage gap is. So it's slowly going away. We're actually at the narrow end of it now. Time's a-flitting. And then catastrophic coverage. Once you hit a certain out-of-pocket dollar amount, you no longer have to pay the same rates. You would pay only 5% of the drug costs at that point. So it's significantly, once you have a lot of prescription drug bills if you hit catastrophic period.
Yes.
But
yes.
that reduces it to only where you pay 5% of those prescription costs. And the nice thing, so all this is very confusing. You know, this is a lot of information to know. That website where we could do that comparison tool, what that does is it simplifies it all for us. It makes it where it shows you, this is what you're paying at this time, this is what you're paying, you can go in June at the pharmacy counter, you'll be paying this dollar amount approximately. You'll be paying this amount in November toward the end of the plan year. It will take you through and give that individual, that beneficiary, what they can expect for a cost. And yes, those costs can change, but you're giving them a really good estimate of what their out-of-pocket costs will be. And it's a nice glimpse at that plan for that beneficiary. So the legwork, all the hard work's done, it's just we'll teach you how to read those things so that you can explain it to somebody. So Medicare is, like I said, not free. And we're gonna actually have a presentation just on extra help and Medicare savings programs. But there is assistance for help with Medicare Part D, that prescription drug cost. And there's also, and that's called extra help. That's what the program is actually called. And then there's a Medicare savings program, and that helps with costs for Medicare Parts A and B. So that will help with the premium, like the Medicare Part B premium. And sometimes, depending on their income and resource limits, it would also cover additional, be like a supplement for that Medicare beneficiary. So with extra help, that program, it's, what it does is it reduces the cost of the premium, and in many cases, there's an option for that beneficiary to have a plan without a premium at all. It also either reduces or eliminates the deductible, so that initial dollar amount they have to pay out of pocket, and it can also reduce or limit the co-payments, the actual at the pharmacy counter expenditures they have. And if there are income and resource limits, those limits can increase if you have dependents living in your household or you are working and have some working income. And also your resource limits, that would include savings, stocks. You do not have to count the home you live in or one vehicle, and that could be individual or a couple. So your assets would be anything but those things. And we do let our volunteers know those income and resource limits so we can screen people we talk to, because it's always good to help them save additional money if we're able. It's very easy to apply. We help people. We go to Social Security's website, which we'll get into, and it's a pretty quick application and can save them thousands of dollars.
Literally.
Thousands and thousands. The Medicare savings programs, that's the help with the Part A and B. Same thing, income and resource limits. There's 3 different programs. They all have different income and resource limits. A lot of it is because of the funding sources. So, the different pots of federal money that are available, out there. And that's a much deeper level, but that's kind of I always like to know the reasoning for things. So there's different programs, and depending on which one you qualify for, based on your income and resources, would determine the benefits that you would receive. And just to give you an idea, like the QMB, you would have to have the lowest income and resource qualifications to be in this particular program.
Yeah.
But that would cover not only that Part B premium that comes typically out of your Social Security check, it would also cover your visits to the doctors, any co-payments to doctors. It would be like having a very good supplement or a Medigap plan. It'd be similar to that. These two they have a little higher income and resource limits for those two programs, and they only help pay that Part B premium, that $100 in this year, or this case $120.80 this year is the monthly premium. So those only help with that. So it just depends, and actually with this savings plan, you would have to go to Department of Social Service, and they help them apply for that Medicare Savings Program. Another way we can indirectly help them apply for this plan is by applying for extra help, that the Part D help, and then what they'll do is they'll get a packet from Social Services in the mail after they apply. They do a little data sharing so that they're trying to cover everyone and get them on all the help they can get. So Social Services, when they find out they apply for extra help, they'll send them a packet. They have to fill out a little extra information to be able to apply and see if they qualify for these programs, is how that works in South Dakota. And then, as far as, I like to always touch a little bit on the fraud, waste, and abuse, and like I said, we just received this grant a year ago, so we're just on this mission of educating people on how to protect your Medicare number and how to read your statements so that you can determine or at least keep an eye if there's any charges that weren't applicable to you. Medicare fraud, waste, and abuse affects everybody because we all pay taxes that impact the cost of Medicare. So billions of dollars every year are lost just due to Medicare fraud, waste, and abuse. And that impacts all of us because, first of all, our income taxes that we're paying in or that the FICA taxes that you pay in, that money isn't being used as efficiently. Medicare costs, there could be more services, or cost of Medicare could be lower, but people are misusing the system. And that's why it's really important and that's why they came up with this grant, is to help these agencies like ours that are at the ground level, educating beneficiaries. Let them start telling people, check your state. If you get a summary notice that has a colonoscopy and you haven't had one in 3 years, let's bring that up. That's why they come. And what maybe someone will bring up a charge that they don't recognize to you. You can bring that to Tom or whoever your regional coordinator's attention is. But those things are important. Read those statements. That's an easy thing for us to educate the public. And there are 3 easy steps that somebody can prevent that fraud, waste, and abuse just on your own, is to protect that number, protect that card. Don't give out your Social Security number, your Medicare number, because people can bill against that. Detect. Keep an eye out on those statements, the Medicare summary notices, the literature that you get. Make sure that if there is something suspicious or unrecognized, that you are looking into it, asking some questions. Sometimes it can be just a general error, but that costs Medicare a lot of money too. And then reporting it, letting us know so we can report it, or even just having them report it to Medicare that there's a concern out there. So billions of dollars every year is lost to these improper claims. And it does put the Medicare Trust Fund at risk. It's a huge cost to Medicare. Like I already said, Medicare beneficiaries pay higher premiums because of it. There's less money for needed benefits, and it also can impact the quality of the treatment they receive. because of all those things. There are some consequences to the fraud, errors, and abuse, sometimes, because when somebody is, abusing Medicare or fraudulently placing claims against Medicare, there can be medical identity theft that takes place. Maybe someone else is receiving services on your Medicare, Medicare's paying for it on your behalf, but it is being acquired by somebody else. Could be identity theft in that way. It could be, sometimes a provider is just billing for a service that was never received too. That can happen. It can impact your health, because if on your record it states that you have this condition, you could be treated as if you had a condition you really don't have. So it can have a health impact actually to you if they're not communicating well enough and going back, basing their judgments on prior claims. It could be, you could be treated improperly. And also it could cost you money. You could be billed for something that you've never received, or, just trying to think. And Medicare, of course, is billed, you know, sometimes you're not actually the one paying for it, but Medicare gets billed and they receive, it costs a lot of money for Medicare to pay for, some improper claims. Fraud is an intentional billing of Medicare for services that were not received, or billing for something at a higher rate than was justified. So that's intentional, fraud is. Abuse is, maybe they're not medically necessary, or don't meet the standards. They're abusing the Medicare system. Let's say, I'm just trying to think, maybe someone sees a commercial for a back brace that could be covered by Medicare, and it's a substandard product. It's really not a quality product, and then you find that it's not, I mean, that would be abusing Medicare. Maybe it would be medically necessary, but it's not the quality of a back brace you would need to actually treat your condition. Here's some more of fraud and abuse. Billing for services, supplies, or equipment that were not even provided at all. Billing for excessive medical obtaining or giving a Medicare number for free services. For instance, you know, we will give you the, let's see here. We'll give you a free health care or a diabetic reader. And
yeah.
if you were to take this questionnaire, and part of it is giving their Medicare number, well, they get the free thing, but then that company has that Medicare number and can sell it, that kind of a thing. Improper coding to obtain a higher payment. Let's say they bill for, I'm having a terrible time with my examples today. For a general exam, and they included that they did a little procedure or an x-ray that they didn't do, something like that. Unneeded or excessive lab tests or x-rays. Claims for services that weren't medically necessary, and using another person's Medicare number or letting someone else use your number. As far as errors, you know, sometimes it's just a coding error. There are tons of medical codes. It's very complicated. That's probably in South Dakota what we see the most of. We do not jump to fraud and abuse right away. Oftentimes, it's a simple communication with that hospital or clinic, and it's not a problem anymore. They correct it. So, in a nutshell, don't give out your Medicare number, read the statements, and you know, check those.
Report.
I'm just going through this really quick. We do have a personal health care journal back there, so if you want to help us hand those out, people can write down when they went to the doctor, and they can compare that to their statement that they received. Ours looks different than that, which I noticed I need to update that picture. And report it. Let us know. You guys let us know, but you guys are our voice out there educating people to not give out their card and to read those statements. And that's very, very, very important. And that's it.